First, let's talk about the epinephrine vial. The epinephrine 1 to 1000 1 milligram 1 milliliter vial is covered with a plastic dust cover that must be removed prior to inserting a needle. The first step will be to remove it like so. Secondly, in order to remove fluid from a vial, we first need to inject an equal volume of air into that vial as the amount of fluid we wish to withdraw. This compensates for negative air pressure that would be created by attempting to remove fluid. The exact amount will depend on the size of dose you intend to inject. According to the package insert for the epinephrine vial, the dose for adults and children 66 pounds or more is 0.3 to 0.5 milligrams, which is 0.3 to 0.5 milliliters every 5 to 10 minutes as necessary. The dose for children 66 pounds or less is 0.01 milligrams per kilogram, up to 0.3 milligrams, which is 0.3 milliliters. The adult epinephrine autoinjector dose is 0.3 milligrams, so in this case we will draw up 0.3 milliliters of air before injecting it into the empty space above the fluid line. Then draw up your intended dose. Lastly, make sure you express any error before administering an injection. The appropriate injection route for epinephrine 1 to 1000 is intramuscularly or subcutaneously into the anterolateral aspect of the thigh, which is midway down the side of the thigh. Now let's talk about the epinephrine 1 to 1000 1 milligram 1 milliliter ampule. While this product has been recently discontinued, some emergency medical kits will have ampules instead of vials, which are similar in injection site and in dosing, but do have a couple special considerations. First, it is important to know how to open an ampule of epinephrine. To do this, we have to break open a sealed glass ampule. A good technique is to wrap one piece of gauze around the narrow part of the ampule and another piece around the fat part of the ampule. Holding the ampule upright, snap the ampule open by pushing the top away from us. Then, taking one of the syringes from your emergency medical kit, draw up the contents of the ampule by holding the ampule relatively horizontal to the ground. We then express any air bubbles from the syringe by holding it vertically. We then inject the appropriate dose for the age and weight of the patient into the outer thigh. When done, discard the broken ampule and used syringe into a sharps container. Again, this is not the ideal method for a response to an anaphylaxis emergency, but when autoinjectors are unavailable, it is good to understand the alternatives and how to administer them. Thank you for watching.